Hello, my name is Jun Sang.
What's the difference between the VisuMax 500 and 800?
You know how with sports cars, we talk about things like 0 to 100 acceleration time, how fast it reaches 100 kilometers per hour. The faster it is, the better the engine. It's the same idea here. When we perform refractive surgery using a laser, one of the most important factors is how quickly we can finish the procedure. Every surgery involves multiple steps that add up to the total time. But the most critical moment, even in SMILE, is the actual laser emission time. With the current SMILE using the VisuMax 800, laser emission takes around 25 to 28 seconds. But that time has been reduced to 1/4 compared to the VisuMax 500. Why is that? Because with the VisuMax 500, the femtosecond laser fires 5,000 spots per second. It's hard to even imagine, but the VisuMax 800 fires 4 times more than that. It fires 20,000 spots per second. That's why the procedure time is cut down to 1/4. Since the surgery can be completed that much faster, you can reduce the risk of various side effects that could occur during that time. One of the side effects patients often worry about is something called suction loss. In SMILE surgery, there's a device called a PI that holds the corneal tissue in place. It uses suction to hold the cornea steady. Simply put, it sticks to the eye using a strong suction force. This allows the laser to hit the exact area precisely. But if the patient doesn't cooperate well, like moving their eyes too much, turning their head, or tightly shutting their eyes, the suction can be lost, and the surgery would have to be stopped. I've experienced those kinds of situations myself from time to time. But if suction loss happens in 1 out of 1,000 patients during a 25-second procedure, then with a 7 to 8 second procedure, 1/4 of that time, I'd say the chance of it happening is practically 0. That's because suction loss almost never happens at the beginning of the procedure. It usually occurs mid-procedure, around the 15 to 20 second mark, when the patient becomes overly tense. While the laser is firing, that's when suction loss or suction break tends to happen most often. But with the VisuMax 800, the laser part finishes in just 7 or 8 seconds. So even if the patient is uncooperative, there's simply no time for suction loss to occur. Also, every person has a slightly different visual axis. Usually the line of sight aligns with the center of the pupil. But for some people, pupil center and line of sight center do not match. We call that discrepancy angle kappa. For people with a large angle kappa, it's better to center the surgery on the visual axis, not the pupil. This machine shows that location in real time during surgery. And in the case of astigmatism, the axis is really important during the procedure. The axis direction is crucial for correcting astigmatism, but the VisuMax 500 doesn't automatically compensate for it. But with the VisuMax 800, before moving into the operating room, if we use a device called the IOL Master, it maps the axis of astigmatism and syncs it with the patient's position on the surgical bed. So the surgeon doesn't have to mark it manually. The surgery can begin right away. That wasn't possible with the VisuMax 500, which was a bit of a drawback, but now it's become possible with the VisuMax 800.
Can we call the VisuMax 800 a next-gen device?
Well, it definitely is an upgrade. The original VisuMax from Carl Zeiss was the first and only device used for SMILE surgery. But once it showed great results and became the standard, other companies started developing similar devices. So now there are about 2 or 3 devices being clinically used in the market. But honestly, their outcomes don't come close to what the VisuMax 500 delivers. There are still quite a few limitations with those systems. Those companies call their own machines next generation, claiming 4th or 5th generation and so on, but in reality, even their current tech doesn't compare to the VisuMax 500. And the VisuMax 800 is clearly an improvement over the 500. So compared to those, I'd say the gap is so big, they don't even come close.
But the procedure using the VisuMax 800 is still called SMILE, right?
Well, it actually started in Europe. Carl Zeiss officially launched it under the name SMILE Pro. But honestly, the name itself isn't all that important. You can think of it simply as an upgraded version of SMILE, so the equipment moved from the VisuMax 500 to the 800, and the procedure name officially changed from SMILE to SMILE Pro. That's the name we've decided to go with for now, but if we come up with a better one, we're open to considering it. It's something we're still thinking about.
So does that mean the cost will go up too?
Well, it's kind of inevitable, isn't it? It's a surgery using newer, more advanced equipment. And the preoperative tests also need to be more precise. There are many advantages, so it's naturally going to be a differentiated procedure. As for how much the surgical fee will be exactly, it hasn't been officially finalized yet. We're still in discussion. Still, compared to the existing procedure, not just a little, but quite a bit, we do expect the price to go up significantly. That doesn't mean the current SMILE surgery is bad. It still gives very solid results. So we'll continue offering SMILE with the VisuMax 500, while also performing this upgraded version in parallel. That's the direction we expect things to go in moving forward.
What kind of patients would benefit most from this?
It would be helpful for all patients, really.
From what I heard earlier, since it's over quickly, maybe for anxious patients?
That's definitely true. There are patients who get extremely nervous. Among ophthalmologists who do refractive surgeries, there's something we often say, young men in their late teens to early 20s who haven't done military service yet tend to be the most nervous, on average. It also varies a bit by occupation, but in the end, it depends on the individual. Even today, while talking to a patient during surgery, there are people who say, I didn't sleep at all last night, or they say, I really can't do this without taking a sedative. We even prescribed alprazolam to a patient like that. There are also patients with panic disorder and similar conditions. So if someone has an intense fear of surgery or doubts their ability to get through it calmly, the VisuMax 800 would be a great option. They wouldn't need to worry. Suction loss doesn't happen only due to lack of patient cooperation. For example, if the cornea is small, or the curvature of the cornea, what we call keratometry, is too low or too high, or if the patient has very high astigmatism, then the suction can be lost more easily. So for patients with a higher chance of suction loss or suction break, those with small, overly flat corneas or very steep corneas or severe astigmatism, patients with those types of corneas would likely be much safer choosing surgery with the VisuMax 800.